So patients that come that are seeking my consultation should understand that there'll be a lengthy consultation where I'll go over all of the data that's been obtained with their other doctors, and I will try to decide what kind of hair loss they have. It's a much more complicated field than most patients realize. There's probably about 20 different types of hair loss, and a lot of patients just think hair loss is one thing. So I try to decide which type of hair loss, because all the hair losses have different prognosis, different natural histories, different treatment options. So figuring out the kind of hair loss is probably the most important thing that I do. The types of hair loss are categorized or classified into two groups: the scarring hair losses and the non-scarring hair losses. And the word alopecia is a word that patients come and ask me about frequently. The word alopecia is pretty much a non-specific word for all kinds of hair loss. So it's just a classification of hair loss. So the scarring alopecias and the non-scarring alopecias are the two categories. The non-scarring alopecias are much more common. And the main types of non-scarring hair losses are the genetic or patterned hair losses, which occur in men and women. Then there's a condition called alopecia areata, which occurs in all age groups, all ethnic groups, and males and females equally. A condition called telogen effluvium, which is a big long word for shedding episodes of the hair. There are other types of non-scarring hair losses: traction alopecia, caused by grooming practices, alopecias or hair losses secondary to infections or rashes. Most of those fall into the category of non-scarring hair losses. And by non-scarring, we mean that the hair follicles are still maintained, they're preserved, but there's something that's either going wrong with the hair cycle or the follicles have gotten smaller. These are in contrast to the scarring hair losses, or the scarring alopecias, and those types of hair loss, the mainstay of those types of hair loss is that the follicles are destroyed by the process. There's a huge emotional component that comes with hair loss, and I think I understand it. I can help people get through it, and I can refer patients to hair loss support groups. I've been the medical director for the Connecticut National Alopecia Areata Foundation support group since 1993. So I can help patients emotionally and medically deal with their hair loss.